My name is Dr. Dilawar Padhani. I am consultant ophthalmologist and also the managing director of Diamond Opticals Limited. So today we are going to record another lecture, that is glaucoma, which is eye disease or syndrome characterized by abnormally high intraocular pressure and which causes the optic nerve. It is also one of the leading causes of blindness in Africa. And if glaucoma is untreated, it can lead to blindness. Now, what is the incidence is the amount of problem is found in the community. So I'll just take you briefly through the incidence of glaucoma in Africa and Tanzania. So surveys of African population of patients older than 40 years suggest that prevalence of glaucoma averages from 4 to 5% in southern and eastern Africa and 6 to 8% in West African countries. The other statement is Africans have approximately 4 to 5% more incidence of getting glaucoma in their eyes. Now, in these studies, primary open-angle glaucoma has been reported to have prevalence of 70 to 75%, because there is another entity which is known as closed-angle glaucoma. So this is a primary open-angle glaucoma which is more prevalent in African communities. Now, how would you know that you have glaucoma? So most of the time the people, they don't know that they have glaucoma. But the commonest thing when they start realizing that they have glaucoma is poor vision. They will see dark shadows of one side of the eye doesn't see, only one side is seeing. Sometimes if the pressure in the eyes goes very high, then they feel pain. They will also see sometimes halos. If they see a light, they will see there are rainbow type of rings around the light. The other is nausea and vomiting, which occurs in another type of glaucoma, which is closed-angle glaucoma, in which the pressure goes very high. This is not as common as primary open-angle glaucoma. Now, what is the cause of glaucoma? The number one cause is the problem with the drainage of aqueous humor. Aqueous humor is one type of fluid which is being produced in the eye and is being drained automatically without knowing. So what happens if there is a problem in the drainage of aqueous humor? Ultimately the pressure rises and that pressure starts damaging the optic nerve, and then we get problems with the vision. The number two cause is steroids. If the patient is taking steroids, whether it is topical or systemic steroids, they can also have glaucoma. High blood pressure had been associated with glaucoma and diabetes mellitus. So these all diseases are somehow related to glaucoma. Now we'll just briefly talk about types of glaucoma. One is primary open-angle glaucoma, which is more prevalent, and 90% patient will have primary open-angle glaucoma, and 10% will have closed-angle glaucoma. The other category is congenital glaucoma, which is found in children which are born. There is another category is secondary glaucoma, which is found in people with diabetes mellitus or because of the trauma or any other reason, if you have any previous inflammation or infection of the eye. And the other category is normal tension glaucoma. Now, normal tension glaucoma, the pressure is normal in the eyes, but still your nerve is being damaged. Now, who is at risk of developing glaucoma? So there are multiple factors, like number one is age. If the person is above 40, he is also prone to get glaucoma. Africans are more prone to get glaucoma. If you have previous eye problem, as I mentioned earlier, if you have a trauma in the eye, previous inflammation or surgery, you are prone to glaucoma. Family history. If you have a family history of glaucoma, then there are chances that you will end up in glaucoma. Medical conditions like I mentioned, hypertension, diabetes also lead to glaucoma, and steroids. Now, how do you do diagnosis of glaucoma? So the first and most important thing is your vision. Whenever you go to a doctor or an optician, they will check your vision, they will check your numbers, and they will find out whether you're normal you have got a normal vision or not. The second thing which is very important is your intraocular pressure. There are different machines of checking intraocular pressure, so they can use anyone to just check your intraocular pressure. One of the things is known as pachymetry. It is slightly technical, but in which you will find out the thickness of cornea, whether how thick is your cornea. That is also associated with glaucoma. Gonioscopy is also one of the more technical term, which is going to see your angle in the eye, whether your drainage is being proper or not. Visual field and OCT, these are two tests which will be done on machines, and your doctor will advise you when to do it and how to do it. Now, suppose if you have been diagnosed as a case of glaucoma, what next? So there are certain options of treatment. Number one remains medication. So you will be started with the medication, maybe 1 or 2, sometimes 3 medications to control your pressure, and then they will also follow you with the visual field and OCT, how is your nerve behaving. If it is being still losing vision, then probably they will propose you another options for that. The second option is laser surgery. They may give you option of laser for glaucoma surgery. And the third option is surgery, in which a surgery is performed in the eye to reduce the intraocular pressure and to reduce that pressure on the nerve. The other question which can be asked is, can glaucoma be prevented? Now, glaucoma cannot be prevented. If you have this glaucoma, you have it, but can the damage can be reversed if the treatment has been initiated on time. So whatever the loss of the nerve has been done, we cannot reverse it, but we can save it when it is there actually. Whatever vision you have been saved, like 70%, 80%, we can save that vision. Okay, thank you very much. With this we end glaucoma.